Hello, sir. Can I have paracetamol, please? Yeah, sure, but I want to know few information. Okay, sir. You can hit me. Do you have prescription with you? Can I know the details of patient like age, sex, who gonna consume the tablet? Here the prescription, sir. Can you please explain why all those details are required? The drug shows desired pharmacological effect only when they are administered the required quantity. Dose of a drug can't be fixed rigid. It varies according to the various factors. The branch of medicinal science which deals with quantity of dose that administered by the patient is known as posology. Oh. Thank you, sir.
Hello everyone, I'm Vijayaragavan. I'm here to share a few details about posology. Posology is derived from the Greek word in which posos means how much and logos means science. The branch of medicinal science which deals with the dose or the quantity of the drug which can be administered by the patient to have the desired pharmacological action. There is no universal law for rigid fixing of the doses. But, however, the doses can be altered by some factors. They are factors affecting posology. They are enlisted below as age, body weight, sex, route of administration, time of administration, environmental factors, emotional factors, disease condition, accumulation, synergism, antagonism, idiosyncrasy, tolerance, addictive effect, tachyphylaxis, and metabolic disturbance. Now let's discuss how age affects posology. Pharmacokinetic action of the drug changes with the age. As a result, pediatric will have underdeveloped hepatic as well as renal function. They are susceptible to some medicaments, so they fail to detoxify and eliminate the drugs. As a result, they accumulate in tissue and increase the toxic level. However, in elderly people, they are more sensitive to some drug. Example, hypnotic drug may produce confused state in them. Body weight. Patients with heavy physique need larger dose as compared to the weak and skinny patients. Dose is given as milligram of the dose per kg of the body weight at all situations. This technique is applicable when the person is in the weight of 50 to 100 kg. For children, medicament can be determined by body weight than the age. 6. Females require comparatively smaller dose of drug than male due to the presence of more body fat. However, they show some expectation while consuming hematinics as well as iron supplements due to the blood loss in menstruation. It takes longer time to sedate after consuming morphine as well as barbiturates. During menstruation, pregnancy, and nursing, extra care should be taken while prescribing medicines. Purgatory should be completely avoided. Route of administration. Therapeutic action of the drug can be influenced by the route of administration. The drug administered intravenously is much less compared to that of a drug which is administered orally. When the drug administered is compared between the rectal and oral, the drug administered in rectal is much more in quantity compared to that of oral administered drug. Time of administration. Some drugs which taken orally before the meals are absorbed more rapidly compared to that when consumed post meal. The unfilled stomach allows for rapid absorption of the medicaments. Presence of food delay the absorption of the drug. However, some drugs which contain iron, arsenic, and cod liver oil should be always consumed after the meal. Environmental factors. Stimulating medicaments are more effective when they are taken in the daytime, while hypnotic drugs are more effective when they are consumed in the nighttime because darkness are sedative in nature. Emotional factors. Females are more emotional than the man, therefore, the certain medicines require less dose in order to get the desired effect. Disease condition. In certain disease condition of the patient, changes are made in the dosages. For instance, people suffering from the unbearable pain require more amount of analgesic as well as sedative compared to the person suffering from the mild pain. For instance, the drug like barbiturates and chloroprocaine produced prolonged effect in the patients who are suffering from liver cirrhosis. Accumulation. Normally, body absorbs, detoxify, and exits the drug simultaneously. But when the detoxification and the excretion is disturbed, the drugs begin to accumulate in our body, which leads to the poisoning. This may be due to the high frequency of dose or increase in the half life. This can be overcome by decreasing the drug frequency. Synergism. When the combined action of two or more drugs is relatively more than the sum of the individual effect, then it is known as synergism. For example, procaine and adrenaline cause synergism. Antagonism. If one drug counteracts the action of other drug, when given in the combination, it is known as antagonism. To overcome this, the amount of the drug is increased. Example, acid poisoning by addictive. An addictive effect of the drug can be described as the individual effect of both the drug is equal to that of the combined effect of the drug. For example, the medicament which is used for the treatment of asthma. Idiosyncrasy. Idiosyncrasy are generally known as allergy or hypersensitivity. Due to the earlier contact with allergen, a person may develop allergic or hypersensitivity to the drug. This attainment of an allergy is known as sensitization. Allergic symptoms may be vary from person to person. It causes skin irritation to fatal state of shock. Most of the individuals suffer from penicillin allergy. Tolerance. In some individual, prolonged use of the drug may be reduce the efficiency of therapeutical activity. This condition is known as tolerance. Person who use opium, morphine, cocaine, barbiturates are more often became tolerance. Tolerance developed by the particular drug by some other drug is known as cross tolerance. Tachyphylaxis. If a medicament is delivered repeatedly, the cell receptor gets blocked and the pharmacological effect of the drug is simultaneously reduced. Tachyphylaxis or acute tolerance is the term which used to describe the occurrence of reduced reaction which cannot be decreased by the further increase in the dose. For example, repeated dose of epidural in the treatment of bronchial asthma may generate very little response after the prolonged usage. Metabolic disturbance. Change in autoelectrolytic balance, acid-base equilibrium, and body temperature may alter the effect of medicine. For instance, salicylic acid lowers the body temperature if the individual body temperature has been raised. However, they don't possess the pyretic property. Other factors which affect the posology are described below. Person who are nervous, over busy, and high strung require a small amount of stimulant, but they require comparatively large amount of sedatives and depressant than the patient who are dull. Person who does a field work and a strenuous physical activity requires comparatively larger dose than the person who doesn't do much physical work, who does only desk work and leads a sedentary lifestyle. Some drugs like cathartics are much more effective in a warmer climate than the cold climate, hence they are taken in smaller doses. So these are the factors which are affecting posology. One should be concerned all the factors before prescribing the medicine to the patient and before taking them. And thank you for everyone who are watching this and providing me this opportunity.